Also NMB, is an organic compound of the thiazine class of heterocycles. It is used as a stain and as an antimicrobial agent. It is classified as an azine dye and the chromophore is Acacian. The anion is often unspecified. NMB is a staining agent used in diagnostic cytopathology and histopathology, typically for staining immature red blood cells. It is a supravital stain. It is closely related to methylene blue, an older stain in wide use. New methylene blue is chemically different from methylene blue, which is a poor reticulocyte stain. New methylene blue stains the reticulofilamentous material in reticulocytes more deeply and more uniformly than does brilliant crystal blue. Better and more reliable results are obtained with new methylene blue. New methylene blue stain is used to supravitally stain viable erythrocytes. The RNA in young cells is precipitate and stained deep blue. The stained RNA appears as blue granules which may be connected into a reticulofilamentous pattern. The specimen that used for reticulocyte count using new methylene blue is blood.
Reagents that involved in the staining of reticulocytes includes 1% of new methylene blue in a diluent of citrate or saline, new methylene blue or brilliant crystal blue for 1.0 gram, 3% sodium citrate for 20 ml which functions as an anticoagulant, 0.9% of sodium chloride solution for 80 ml which provides osmolarity as that of a blood.
Reticulocyte staining. Pipette 5 drops of fresh methylene blue and solution into a test tube that has been labeled. Add an equivalent volume of well-mixed blood. By using pressure pipette, carefully combine the ingredients. Incubate for 10 minutes at room temperature. Prepare 2 rich smears by properly resuspending the mixture. Immediately air dry the stains by gently waving a slide. Label the reticulocyte smears by writing the information on the thick end of the smear. Reticulocyte counting. Select a region of the smear where the erythrocytes are equally dispersed and without overlapping with the oil emission lines, and an ocular equipped with a mirror disc. Each oil emission area should have 80 to 100 erythrocytes. Next, there are a total of 20 fields to count. Count erythrocytes including the reticulocytes in the smallest square and reticulocyte in the biggest square in each field. A second clinical laboratory professional should perform the same reticulocyte on a second smear. Laboratory quality control, also known as QC, is to ensure that lab procedures and activities operate smoothly and that correct and repeatable findings are produced. Furthermore, the QC measures are produced in the lab serve as a foundation for the certification. The quality control for the reticulocyte count new methylene blue is to check the calibration by calculating the average red cells count in 5 big areas and 5 tiny areas to ensure that the proportion equals to 9. This will be only true if the blood cells are uniformly distributed over the slide. The number of reticulocytes in the full square is then divided by the amount of red cells in the tiny square in succeeding fields until the required number of red cells is reached. Commercial quality control materials with predefined control limit should be conducted on a regular basis. The frequency is detected by the workload of each laboratory. Next, for new methylene blue, the appearance should be dark blue liquid and pH must be 5.7 to 6.3. The sterility is no bacterial or fungal growth is observed after 14 days of incubations. Store the methylene blue at 2 to 8 degrees Celsius away from bright light. Lastly, use methylene blue before expiry date given on the product label. Reticulocyte count have generally been used to record the presence and severity of hemolytic anemia or to evaluate bone marrow functions. Methylene blue has been widely employed in the photooxidation of both natural and synthesized compounds. There are two principal photochemical processes that are commonly observed. Type 2, in which the triplet energy is transmitted to oxygens, resulting in single oxygens, and type 1, in which reducing agents contribute one electron to the empty triplet, resulting in the semi-reduced radical. Next, methylene blue has found use in a wide range of therapeutic settings, from dementia to cancer treatment. Furthermore, MB serves as a basis for antimicrobial chemotherapy and ultimately leads to the development of the neuroleptic drug families.
The advantages involved two types based on the research paper. Firstly, the reticulocyte hemoglobin content. The reticulocyte hemoglobin content is the product of the cellular volume and the cellular hemoglobin concentration. Reticulocyte hemoglobin content provides a reliable measure of the functional iron available for new red blood cell production over the previous 3 to 4 days and proved to be sensitive indicator of early iron deficient erythropoiesis. Next is absolute reticulocyte count in the diagnosis of pediatric anemia. As the reticulocyte count distinguishes disorders resulting from rapid destruction or loss of erythrocytes from disorders resulting from bone marrow failure, we strongly suggest its use in the initial diagnostic workup of pediatric anemia. In these patients, absolute reticulocyte count is a very useful index in identifying transient marrow suppression and the need of transfusion. Absolute reticulocyte count reflects both spontaneous bone marrow recovery, for example, after transient bone marrow suppression caused by a viral infection, and response to therapy in iron deficiency anemia. In conclusion, the reticulocytes are an important guide of the amount of red blood cell produced in bone marrow and entering the peripheral blood. It is therefore an index of effective erythropoiesis. Its normal fraction in the blood is low, which is 0.5% to 2.5% in adults and 2% to 6% in infants, because there is a homeostasis between destruction of each abnormal red blood cell and a low level of marrow activity required to maintain normal hemoglobin levels. Reticulocytes count serves as a key tool to assess the bone marrow's ability to increase RBC production in response to various types of anemias. Precise and accurate reporting of reticulocyte count is imperative, as raw reticulocyte count may be misleading in anemic patients.